Welcome to the latest episode of Manrina's Mentorship podcast. I'm very happy to welcome Dr. Nikola Kulik here with us today. Nikola is one of my lovely mentees and she's one of my youngest mentees, but I'm really interested to hear her journey that's led her to now, led her to be what I see as this achiever, to already be pushing so hard at such a young age, just like I did. And we're even more excited to see where she goes moving on from this. So Nikola, welcome.
Thank you. Thank you for
having me.
Let's go
right back to the very beginning, to you being born. Where were you born?
So I was born and raised in Poland, born in a small town called Sławno, where I spent my early childhood. And then when I was about 10 years old, we moved to the seaside with my family to a different town called Ustka, where I lived until I was 16. And at 16, I moved out to a bigger city by myself.
Really?
High school, yeah.
Wow. Okay, so firstly, living by the coast has always been a dream of mine. Did you do a lot of water sports? Like, what was the weather like there?
Not really. In Poland, it's quite cold.
Okay.
So, yeah, it's known for swimming in winter, you know, like cold plunges and things like that, but not really water sports. Although I love swimming and,
but it was
swimming
too cold.
And traveling. Yeah, in Poland, it's too cold, unfortunately.
You moved out at 16.
Yeah, so I didn't plan on moving out at 16. I always thought that I will move out for university. But when I was 15, I won a biology exam. And I got an invitation letter to study at one of the best high schools in Poland.
Wow.
And they also offered IB program, which is an equivalent to A-levels.
Okay.
So it was a program taught in English. And then it was an amazing opportunity. And me and my parents decided that I will move out and attend this high school. And that was the best decision. And it's when everything started
Changing for you?
Yeah, changing.
So it wasn't a boarding school? You just literally lived by yourself? There was no one cooking for you?
No. Yeah. So in first year, I was living in a dorm, 5 girls in one room.
Okay.
It was very challenging. But then I met one of my best friends and we started renting together.
Wow.
And then I started thinking about applying to universities abroad.
Yeah. Oh, abroad. Wow.
Yeah.
Okay.
Because it was an English taught program.
Yes.
So it was
your
a bit
direction.
easier for me to apply abroad with that qualification.
Wow.
I think.
Wow. So did you do dentistry abroad? Where did you do your dental degree?
So I got an offer from King's College.
Yeah.
So I studied at King's.
Okay, amazing.
Yeah, it was an amazing opportunity.
Wow. So you came here as an international student.
Yeah.
And then
At
again
18, not 19.
Wow.
19.
And then you were living, well, I guess probably in student accommodation.
First year, yeah.
But in a new country by yourself, having come over. Wow, so really independent young lady to have moved out from so young and then moved countries as well. You've not lived with your parents for a little while now.
Yeah, almost like 9 years.
Wow. Oh.
Yeah, I've always been quite independent and self-reliant.
Yeah.
And I always took things into my own hands.
Yeah.
And I knew I have to work for whatever I want to achieve in life. I never waited for people to do things for me.
Yeah.
But my mom is the biggest inspiration for me because she's such a strong woman. Had me when she was 20.
Oh, wow.
So everything that I do, it seems small because
she was
already
at 20.
Exactly. So and she had to worry for herself and for me. So so she's my best friend as well.
Wow.
We are so close. So it's really hard to be away from my family.
Yeah.
They're my biggest supporters.
Yeah. And your dad?
So I have a wonderful stepdad. My dad wasn't present in my life, but that's for the best.
Wow.
I think.
Okay.
Yeah.
So from 1 to 10, you were somewhere, and then at 10 when you moved, you and your mum, the two of you.
So my mom got together with my stepdad when I was very little. So my mom and my stepdad raised me, basically. Okay. My dad wasn't in my life, and he passed when I was 14.
Okay.
Yeah. But we were never really close.
No.
And he didn't have any impact on my life.
No.
Nothing like that.
And no siblings?
I have a half sister. She is 12.
Oh, cute.
Yeah, so there is a big difference between us, but she's lovely.
Yeah. And she's in Poland?
Yeah.
Do you go home much?
Every 3 months, every
Okay.
3 or 4 months, yeah.
So often.
Yeah, quite often, because
Yeah.
I'm really close with my family.
Yeah. Wow. So tell me about Kings. How was that moving countries?
So moving was much more challenging than I thought, because I've already moved out at 16. I thought it's not going to be a big change. I can already manage myself, and I don't mind my own company. So I thought it's going to be okay, but it was actually very, very challenging. It was quite lonely because I moved in lockdown.
Oh.
So it was, I didn't really have any freshers or anything in the first year of university.
Oh.
I didn't have any friends or family here when I moved.
Oh, wow.
So it was quite lonely in the first year.
Where did you live?
In the student accommodation.
But it was COVID, so were there other students there?
So there were only medical students because everyone else could study remotely, whereas dental and medical students had to be in person, like every 2 weeks for in-person classes and labs.
So was there medicine and dentistry were there? Okay,
Yeah.
so you had...
But not that many people were in the dorm. Most people were at home and they were just commuting whenever they needed to be at university. So it was quite challenging.
And making friends in COVID must have been awkward because were you meeting them but you were wearing a mask?
Yeah, it was also... I think I've never really struggled with confidence, but when I moved here, I don't know why, but I developed an imposter syndrome. I think it was because I felt, a bit different. I have an accent. My English wasn't that good back then, so I thought, I was quite ashamed of my accent and I didn't want to speak. So I was quite shy. So it made making friends a bit more difficult, but I think, now I own it and I don't care.
Yeah.
Now I found my people. I met some of my best friends at university. So it all worked out.
How did you meet them?
So at university. So every year we would be changing groups at university. So I would be meeting new people. So I met some of my best friends at university, but also outside.
Because so you had the COVID year. Then after the second year, were you back in person meeting people?
From second year we were back in person, but not lectures. Lectures were online for the whole 5 years of university.
Really?
Yeah, and we were only attending clinics.
Wow.
In person,
so
and
those small
tutorials.
clinical groups, you didn't have anything with the whole year group together?
Yeah, exactly, no.
Wow,
Just
interesting.
I don't even know some of the people I was in the year with.
No way, such a different experience from us. And so why dentistry?
So when I was younger, I always wanted to help people with their insecurities. And I thought I would be a plastic surgeon. Or I was really interested in aesthetic medicine. The turning point was when I did my work experience. I went to Sri Lanka as a volunteer.
Wow!
When I was 18,
Wow.
I spent 3 weeks in Sri Lanka. I was living with host family, and I observed in the different departments in the hospital. We were also helping and educate children in schools, and we were also doing some health community screening. Checking people's blood sugar, things like that. So it was really interesting. But then when I was observing all the surgeries, I just felt that medicine is not for me. And then I started thinking about alternative pathways. And we were also in the dental department, which I really loved. Just the energy, I think, in the room was really nice. And then I knew it's dentistry.
And then did you take a year out? Because did you say you came at 19?
So 18, I went to Sri Lanka. It was when I started looking into applying to universities. They always stress a work experience. So then I started planning towards my application. I went to gain work experience as a volunteer in Sri Lanka. And at 19, I moved to London. So I didn't take any years out.
It's just here it's 18, but maybe in Poland it's 19.
Yeah,
you start
so
university.
in Poland I went to school when I was 7. So it's just 1 year after.
Okay,
cool.
So then you were like, okay, dentistry, and then did you start applying? Did you apply to different countries as well as the UK, or was it always going to be the UK?
So my dream was always to go to the US.
Oh, wow.
Yeah, but the process is a bit more difficult to
Yeah.
go to the US, and it's more expensive.
Yeah.
So UK was more feasible, and I only applied to the UK because I wanted to go to an English-speaking country.
Yeah.
And yeah, the UK has one of the best universities as well, so it was always UK.
Yeah, so you applied to different dental schools in the UK. You didn't apply in Poland?
No.
Oh.
No, because the application process for UK was earlier.
Okay.
So before the application process opened in Poland, I already knew I got an offer from King's, so didn't have to.
Amazing. Okay, and you didn't graduate that long ago. So tell me, so university was a good experience? You feel you made the right choice going into dental school? Actually, tell me about your interest in helping people with their insecurities. That I thought that was interesting that you said that. Where do you think that came from?
I think I always liked watching TV shows when they do transformations, and I think I've always been into medicine and a little bit of beauty, and I wanted to combine it and help people and have an impact.
Yeah,
I think that's
so
the main thing.
It's dentistry, but then is it really cosmetic dentistry?
So I'm still very much open to all fields within dentistry, but cosmetic dentistry was always on my mind.
Yeah.
So before I even started studying, I thought I'm going to be a cosmetic dentist.
Yeah.
And I was surprised that at university I didn't really learn anything about cosmetic dentistry. There's so much more to dentistry.
Yeah, because when did you graduate?
I graduated last summer,
Wow.
so July 2025.
Wow, so not even a year yet.
8 months. It's been 8 months since I started dental foundation training.
Okay, wow, amazing. And how is that going?
So it's quite challenging because I'm working in a very high needs area, East London, working mainly NHS practice.
Yeah.
So day to day, I'm doing extractions, dentures, root canals, fillings, everything, seeing kids and elderly people. So it's not where I envision myself to be.
No.
But I know it's it's when I've grown the most. It's been such a steep learning curve.
Yeah.
But now I feel much more confident in general dentistry, and I realized that it's needed. It's that foundation is essential.
Yeah,
you can't really skip that step.
And practice, really, all these treatments, because you don't get to do so many at university.
Exactly.
I mean, how many root canal treatments did you do at university?
I think I've done one, and now I'm doing them. Yeah,
every day. Yeah. So, and because how often? I mean, because I think people talk a lot about how clinically you don't get as much experience at university now as maybe we did when we did that. That your quotas are less. What were the quotas like at university?
So we didn't have quotas as such, but we had to pass a practical exam on every procedure.
Okay.
So you had to pass a root canal, dentures, extraction. So someone had to sign you off for those.
Okay. That you say you've done it.
Yeah.
Okay, good.
And I think dental foundation training is testing me every day in every way.
Yeah.
But even though it's so hard and I'm tired, exhausted, I don't have energy for anything else when I come back home.
Yeah.
I'm still loving it.
Yeah.
I still
so much
love
learning.
dentistry.
Yeah. I think it's really good to use your hands, like to get your hands working.
Yeah.
And that's what it does. And it allows you to learn and practice and try new things. So you were maybe the youngest person to ever do designing smiles because you did it in your vocational training year. And I've definitely had delegates before just after their vocational training when they finish and then they want to start doing more private treatments. But in a way, it was the perfect time to do it because now while you're in this environment you can practice these smile makeovers on these patients. You can do you want some videos? Right, let's have a go and let's do them. Have you had an opportunity to do that?
So it's definitely a more safe environment to do that. Unfortunately, I haven't had any cases yet because it's mainly NHS.
Yeah, but can you do veneers on the NHS? You can.
I can, yeah. It's just you always do the most minimal invasive treatment first.
Yeah.
So it's kind of a bit hard to find cases, but if I do find a case, I'm definitely more prepared and I'll be going in confident.
Maybe someone with large anterior fillings or a mottled enamel, decalcified enamel, because someone who wasn't brushing their teeth as well, you could help them with their hygiene, get their hygiene better, and then do some lovely veneers on them. Because I think this is your time. Like, what a great opportunity to have this cohort of patients who would really appreciate the treatment, and for you to use what you learned. How did you find designing smiles?
So I found it through your mentorship. So I think I joined the mentorship before the designing smiles course.
Let's talk about mentorship.
It's so important.
Tell me how you came across the mentorship.
So I remember you spoke at King's.
Yes.
I think it was Aesthetic Society conference.
Okay.
And then I really loved your vibe.
Oh, thank you.
Your confidence and positive energy.
Yeah.
And I think then I messaged you because I was hesitating between going into foundation training or going straight to private.
Oh.
And then we started speaking, and I really loved that you spent the time and you messaged me back, and it was so valuable at the time. And then I just kept in touch with Laura, and we started the mentorship when I was ready. So it started in January.
Yeah.
And it's been really good.
Yeah.
It opened my eyes for so many things that are important in dentistry aside from the clinical.
I feel like
dentistry.
You've elevated yourself to, definitely the top 5% of dentists in the country at this very young age, like understanding about patient communication and how to present a treatment plan and all the different treatment options that are available. Like, there's so many things, isn't there, that we go through. Never mind building out your personal brand and the work that you can do with that to set yourself up for the future. So how perfect for us, or for me, to be able to mold a dentist from such a young age and literally turn you into the perfect, I won't say the perfect dentist, and if you want to do cosmetic dentistry, then definitely the perfect cosmetic dentist. Tell us more about how the experience has been for you. You've learned different things. Tell us a little bit about what you've learned while being in the mentorship.
So I've definitely learned things that I didn't know I have to learn.
Tell me about that.
About personal branding, communication, public speaking, putting yourself out there, creating a 5-star patient experience. So all the things that are so important aside of clinical dentistry. And there's so much to learn. So I'm just in the beginning of my journey, but so grateful for the opportunity and to learn from the best. Like, I want to be molded by the best.
Thank you. And I want to mold you. so it's a good team. And then, so from there, you came on to designing smiles, and maybe was that an introduction for you to smile design, because you're not really taught that at university. So for you, it must have been like, even for experienced dentists, and we've had people in their 60s that have come on my designing smiles veneer course. It's a lot of new stuff. So for you, it must have been, was it eye-opening?
So now even though some of my patients are not interested in cosmetic dentistry, I take time during my consultations and exams to have a look at their smile, what can be improved, just for myself, for practice, because everyone is different, every face is different.
And photography.
Yeah, I have a camera, so it's invaluable.
Yeah.
And so if I get a case that is suitable, I'll definitely start thinking about doing veneers.
Do it.
But I just need to do it.
Just do it. Yeah, exactly. And I'll support you. So, when the patient comes, you send the pictures on the WhatsApp group, I'll remind you, make sure you know your protocols, you know what you're doing, and help make sure that it all goes perfectly. And then the more you do, the more confident you'll be. And then, then you can just fly with it. What about facial aesthetics?
So I'm actually doing a level 7 diploma alongside dental foundation training in facial aesthetics. I believe facial aesthetics and dentistry go hand in hand.
For sure.
Because you can't assess a face without teeth. And then you need to, if you're designing a smile, you need to look at the face. So I think it's been also invaluable because I've learned so much about facial assessment and what can be improved.
Yeah.
And I think as dentists, we are very, very well suited to be doing facial aesthetics.
Injecting.
So, yeah.
We're good with needles and and the
Yeah,
face
so it's
and our
been
hands.
great.
Yeah, amazing. So what's next?
So
What's the plan?
the plan is so I'm due to finish my dental foundation training at the end of August.
Yep.
And then I'll be working in a mixed practice as an associate. And plan is just to keep growing, improving my skills, and hopefully in the few years just focusing on cosmetic dentistry.
Yeah,
mainly.
or I guess depending on which way life takes you, because like you said, you're exploring all of it right now.
Yeah, I'm
there's
very
no harm in
open.
that. Yeah,
because in cosmetic cases, you also need to know, for example, if someone comes with an implant, you need to know how to manage that. So I think I'll need to learn oral surgery, periodontics, everything.
Yeah, this is your time. Like learn everything,
Yeah.
see where life takes you, and there's no harm being really good at everything. You know. So I did my implant training, and now I don't place implants anymore, but I restore my implants, and so it's good to have that training behind you. And there may be other bits that you enjoy along the way. Any sort of ortho qualification that you get is only going to help with your clear aligners or whatever you decide to do. And similarly, for all of it, periodontal qualifications with your gum lift or your gingival grafts, if you do go into cosmetic dentistry. So it's all like one big interchangeable profession, and then you pick your favorite bits. But I think your 20s are for doing as much as you can and seeing
and that's what I'm trying to do. I think investing in your career is very important. And I was also considering specializing in orthodontics, but then I joined your designing smiles course because I wanted to see if I really like cosmetic dentistry, because we are not taught cosmetic dentistry at university. I haven't had any exposure, so it's difficult for me to make a decision. And I think the course really showed me that it's something that I want to do.
You could feel it. Yeah, because I could also see you as an orthodontist.
I'm not saying no. Maybe in the future I will do a master's.
It's early
in
days. Like literally, you've
exactly.
got this whole life ahead of you, which is very exciting. Is there a piece of advice that you could give to our listeners through your journey so far that you could share?
I think my piece of advice would be to train your mind to work in your favor, because I experienced it myself. There were so many times where my fear prevented me from doing something. And also, and I strongly believe that, we have control over our lives and we can achieve anything we want. We just need to work hard and believe in ourselves.
So how do you think you learned about that, about having being able to control your mind?
So I think it's just, when I look back, when I was 15, I won that biology competition.
Amazing.
And then it led me to moving out and studying at the best high school, one of the best high schools in Poland. And then I studied really hard, and then I applied to
the best dental school in the world.
And I got accepted, and it just shows how, whatever you want to achieve is possible. You just need to put in the work. And also overcoming challenges. So moving countries at 19, it showed me that I can do hard things.
You can.
I can overcome challenges, and it just builds your self-belief. And I think then nothing is scary after that. When you just push yourself and you do hard things and get out of your comfort zone.
And maybe you learned some of that from your childhood. If it was difficult with your father, then maybe there was something there that already kind of taught you that things can be difficult and you'll be okay.
I think seeing my mom at 20, because I remember everything vividly. I don't know why, but just we were like this power team trying to figure everything out together. Because it's always been my mom and I, and then my stepfather came into the equation, and he's wonderful as well. And they've always supported me in pursuing my dreams. So I think that self-belief also comes from the family support. which is
Yeah.
so important.
Yeah, and it's all gone so well for you. It almost feels like this is the way things were meant to go. Do you feel like along the way anything hasn't worked out how you wanted it to go yet?
So it's definitely taking longer than I thought it would. So I've already been through so much, and I feel like I'm just starting out.
Yes.
There's so much ahead
Yes.
that I still want to accomplish
Yes.
and do. And yeah, so it's just, I think, trying to be more patient
Yeah.
with myself, because
Yeah.
I want to achieve
Do
it all.
everything right now.
Yeah, exactly.
Yeah, which is what you're doing with the level 7 while you're doing DFT, while you're doing the mentorship. You're like, right, I get it because I recognize myself in it. You know, I'm always like, oh yeah, this, you know,
So
let's do it all
I
right
think
now.
it's going well.
Yeah.
It was some challenges along the way, but that's life. It's just, I think, trying to be a bit more patient with the journey and embracing the journey.
Yes. Yeah, embracing every step, because I love that you've realized how important DFT is.
Yeah.
That it might not feel like you're doing the treatments you want to do, but just spending that time actually practicing these treatments and doing them, that's what that gives you the opportunity to do. You know, doing whatever 50 fillings a day, or you know.
Yeah, it gives you, you know, you improve your hand skills. You become more confident with patients and all sorts of problems that they have.
Yeah.
And I think, having that foundation is essential. Coming out of university, you don't know what you don't know.
You don't know what you don't know.
Like, exactly.
That's a good one.
And I realized there's so much to learn, and I'm very humble. But also, I know my limitations, but also I'm quite focused, and I try to give my career a direction.
Yeah.
So I want to go towards more cosmetic dentistry. So on top of DFT and building my foundation skills, I'm doing mentorship courses. Just on top of that, because I think we need to make our own curriculum when we graduate. There's nobody telling us what to learn and how to get there. So I think mentorship is important, because then you can go from A to B faster, and then people that can guide you and support you.
Nikola, I'm so excited to see what happens in your career and in your future. I feel like this is step one, and I feel like we need to do this again in like 5 years and be like, where are you now? Because I think you've got, well, I know you've got a very exciting future ahead of you. So thank you so much for joining us today.
You.
And I guess watch this space.
Thank you so much, Manrina.